Be as precise as possible. Be as short, as precise as possible. Now, failure to thrive, is it a long-term condition or is it a short-term condition? What do you think?
Short-term condition.
Perfect. Is it a common condition, very common condition, fairly common, or uncommon condition, Dr. Mahmoud?
We can say it's fairly common.
Yes, fairly common condition. What normally happens? A child fails to gain weight in correspondence to same peers of age, gender, and ethnicity. So it's age. The mnemonic is age. Age, A for age, G for gender, E for ethnicity. Okay? So failure to gain weight according or in correspondence to same peers of the same age, gender, and ethnicity. Okay. Unfortunately, now complication. Unfortunately, if left untreated, what's going to happen? The child might dehydrate. Unfortunately, it might be sinister if left untreated. But the good news is there are lots and lots of ways on how we can help you tackle this in a very proper way. What are your thoughts about that? Would you like me to talk you through that? Okay, this is how to explain a diagnosis to any patient. Any diagnosis. Start with, is it a common condition, uncommon condition, fairly common condition? Is it a long-term condition or is it a short-term condition? Explain your diagnosis. After you explained it, is it treatable? Is this condition treatable? Can it be brought under control or not? This is very important. But the good news is there is always help and support out there. And I'm more than happy to talk you through that in detail if you like. What are your thoughts about that? Okay, any diagnosis, really any diagnosis, you can always use your structure. If you don't have a structure in your exam, unfortunately, that's going to waste your time, puts you at risk of not passing the exam, not passing management part, which is 4.5 marks. Now, what are causes to failure to thrive? What are causes of failure to thrive? Anybody knows what are causes? Failure to thrive is not a diagnosis.
Yeah, it's a symptom.
It's a symptom.
Yeah, and usually, if you have a child, you have to exclude celiac disease,
okay,
and
perfect,
cow milk protein allergy,
perfect,
and also sometimes, which I couldn't say that it's common, the cystic fibrosis.
Okay, perfect.
And also there is something very important you have to touch base on, the safeguarding.
Perfect. Yes, all of these are very important to bear in your mind. Actually, safeguarding should be in your mind, in the back of your mind with any patient, specifically children, specifically elderly people or vulnerable people. This is very important. Thanks so much, Dr. Mahmoud. Yes. Whenever you're starting your consultation, please, as much as you can, please start with your eyes. Try to get ice out of your way as much as you can. Ice, very important. I can't stress more on getting ice early on. Don't let ice flow at the end. This is not the case. Leaving ice till the end, there is a major risk that. So for example, if to any patient, if you tell the patient you take the whole data gathering, at the end you ask the patient, okay, and can I know what are you worried about? Then the patient tells you, oh, doctor, can it be cancer? And you realize that you haven't asked cancer questions in your data gathering early on. What's going to happen? You're going to go back. You're going to ask the patient again questions about cancer because you haven't asked the patient early on. Then what's going to happen? You're going to waste your time. You are going to prolong your consultation, and your consultation will sound unorganized.